Hi, this is Pratima and you are watching Planet Physiology. Today we shall discuss the topic hypoxia under following headings: definition, types of hypoxia with important features of each type, and effects of hypoxia. This is one of the most commonly asked questions. So let's start with the definition. The word hypoxia has two components. Hypo means less and oxia for oxygen. Hence, hypoxia is defined as deficiency of oxygen at tissue level. Now, before we classify hypoxia, let's have a quick look how oxygen is made available to the tissues for cellular utilization. Normally, we breathe in atmospheric air, which has about 20% oxygen. So, source of oxygen in our body is atmospheric air. As this oxygen reaches the respiratory membrane, it is then taken up by the blood, mainly the hemoglobin, and then oxygen is transported with the help of circulatory system to all the tissues. At capillary level, oxygen diffuses out and is taken up by the cells for energy production. So, these four steps: oxygen availability in the alveoli, its uptake at the respiratory membrane, oxygen transport with the help of hemoglobin and circulatory system, and its uptake by the cells are very important in making oxygen available to the cells. So if there is hypoxia, there must be problem in at least one of these steps, and based on the level of fault, hypoxia is traditionally categorized into four types as hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Before we start details of each, you should have clear understanding of various terms used in the discussion. So first is PO2. It means partial pressure of oxygen, and it represents oxygen in dissolved form in the blood. Then oxygen carrying capacity of the blood is mainly related to the hemoglobin content, as about 98% of the oxygen is transported in combination with hemoglobin. The term hemoglobin saturation deals with oxygen in combination with hemoglobin, while oxygen content includes hemoglobin content, its saturation, as well as oxygen dissolved in the blood. Another term you should know is arteriovenous oxygen difference, which is abbreviated as AV oxygen difference. It means difference of oxygen content in the arteries and the veins. It indicates the amount of oxygen extracted by the tissues. Okay, with this background knowledge, let's start with the types of hypoxia. The first is hypoxic hypoxia. It is hypoxia due to low arterial PO2. It is caused due to less PO2 in the inspired air itself, as in case of high altitude, or it may be due to various respiratory diseases where oxygen uptake by the blood is reduced. For example, hypoventilation, which may be due to airway obstruction, paralysis of respiratory muscles, or depression of respiratory centers, say due to barbiturate poisoning. Also, any condition affecting oxygen diffusion across the respiratory membrane like pulmonary edema, fibrosis, atelectasis also decreases oxygen uptake at the respiratory membrane. Hypoxic hypoxia also results due to right to left shunt, that is veno-arterial shunt, as in case of ventricular septal defects. Here, in later stages of this condition, the right ventricular hypertrophy is developed, and hence the blood is pushed from right to left ventricle, leading to reduction in the arterial PO2. So in hypoxic hypoxia, oxygen carrying capacity of the blood is normal, but arterial PO2, oxygen content, and hemoglobin saturation are reduced. Rate of blood flow to the tissues may be normal or even higher to compensate for hypoxia. Same is shown in this oxyhemoglobin dissociation curve. This is a normal curve where arterial PO2 is about 97 millimeters of mercury, and at this pressure hemoglobin is 97% saturated. Oxygen content is 20 ml per deciliter. This is represented by this pink area under the curve. Venous PO2 is 40 millimeters of mercury and hemoglobin saturation is 75%. Oxygen content is 15 ml per deciliter, represented by blue area. In hypoxic hypoxia, PO2, hemoglobin saturation as well as oxygen content are reduced as indicated by pink and blue areas in this curve. So because hypoxic hypoxia is caused due to low oxygen availability, oxygen therapy is very useful to treat it, except in case of right to left shunt and depression of the respiratory centers. Oxygen supplementation helps to increase arterial PO2, hemoglobin saturation as well as oxygen content in the blood. It can be provided by using oxygen tent, oxygen mask or intranasal tube, or it may be with the help of ventilators, mechanical ventilators, as in case of semi-conscious or comatose patients. Now coming to the second type of hypoxia, anemic hypoxia. In this case, inspired PO2 as well as diffusing capacity of the lungs is normal, but blood cannot pick up enough oxygen due to decrease in hemoglobin content. Hence, anemic hypoxia is due to reduction in oxygen carrying capacity of the blood. Another common cause of anemic hypoxia is carbon monoxide poisoning, where hemoglobin content is normal. But as carbon monoxide has 210 times more affinity to hemoglobin than oxygen, it readily binds with it to form carboxyhemoglobin, and hence oxygen carrying capacity is reduced in spite of adequate availability of hemoglobin. Carbon monoxide is common pollutant in smoke, including cigarette smoke, and hence in heavy smokers carboxyhemoglobin content is high. Anemic hypoxia can also result due to presence of abnormal forms of hemoglobin like methemoglobin, which reduces oxygen carrying capacity of the blood. Let's see its features. Since PO2 in alveolar air is normal quantity of oxygen dissolves in the blood and hence arterial partial pressure of oxygen is normal. But because hemoglobin content is low, oxygen carrying capacity is low, oxygen content is low. If anemic hypoxia is due to carbon monoxide poisoning or due to presence of methemoglobin, then oxygen saturation is reduced but not the hemoglobin content. Rate of tissue blood flow may be normal or it may be higher to compensate for hypoxia. Another important feature of anemic hypoxia is it does not stimulate peripheral chemoreceptors as arterial PO2 is normal. Remember this fact for your MCQs. In mild to moderate anemia, oxygen supply in the tissue is not much affected due to rise in 2,3 DPG levels, which shifts oxyhemoglobin dissociation curve to the right and facilitates oxygen delivery to the tissues. But these persons develop severe hypoxia during exercise due to increased oxygen demand. As in this case, hypoxia is due to decreased hemoglobin content, treatment should be aimed to correct the anemia. Oxygen therapy is somewhat effective to treat hypoxia as it can increase the dissolved oxygen to some extent. In case of carbon monoxide poisoning, hyperbaric oxygen therapy is very effective. Hyperbaric oxygen means administration of 100% oxygen under high pressure. It increases PO2, but even more important that it displaces carbon monoxide from hemoglobin and allows oxygen to bind with it. But hyperbaric oxygen should be administered with caution as it may cause oxygen toxicity. The third type of hypoxia is stagnant hypoxia, which is also sometimes called as ischemic hypoxia. Here, hypoxia develops due to decreased blood flow to the tissues. Arterial PO2 as well as oxygen carrying capacity of the blood are normal. Since blood flow is sluggish, tissues extract more and more oxygen from the available blood and hence arteriovenous oxygen difference is high. As you can note in this diagram, all the arterial values are normal, but venous values are lower than normal. Hence, arteriovenous difference of oxygen is high, as indicated by widened red area. Stagnant hypoxia occurs in conditions like cardiac failure, where heart is unable to pump the blood, leading to circulatory failure, or in case of circulatory shock. It can also occur in intravascular obstruction. Oxygen therapy is not useful in stagnant hypoxia, as there is no issue related to arterial oxygen content. The last type of hypoxia is histotoxic hypoxia, in which tissues are unable to utilize oxygen in spite of its normal availability. It occurs in cyanide poisoning. Cyanide inhibits enzyme cytochrome oxidase, which plays important role in ATP synthesis. Due to inhibition of cytochrome oxidase, mitochondria cannot utilize oxygen for energy production, and hence there is no cellular uptake of oxygen. Histotoxic hypoxia also can occur in severe diphtheria. Diphtheria toxin inhibits synthesis of one of the mitochondrial cytochrome oxidases, resulting in histotoxic hypoxia. So, in histotoxic hypoxia, arterial PO2, oxygen carrying capacity, arterial oxygen content as well as rate of tissue blood flow are normal, but cells are unable to utilize available oxygen. Hence, in venous blood, all these levels remain almost same as that of arterial blood, and hence arteriovenous oxygen difference is very low. Same is shown in this diagram, where all the arterial values are normal but venous values are high, leading to less arteriovenous oxygen difference as indicated by widened blue area under the curve. In histotoxic hypoxia, as there are no issues with oxygen availability and its transport, oxygen therapy is not beneficial. But hyperbaric oxygen therapy can be helpful as it can displace the chemicals bound to the hemoglobin. Now let's study what are the effects of hypoxia on the body. The effects depend on severity and duration of hypoxia, and the nervous system is mainly affected by hypoxia as neurons cannot withstand hypoxia for longer duration. When a person is hypoxic, in general, body tries to compensate it by increasing ventilation and cardiac output so that more amount of oxygen can be delivered to the tissues. Local vasodilatation also helps to improve blood flow. But whenever there is hyperventilation, it is also associated with washout of carbon dioxide, leading to respiratory alkalosis and hence shift of oxyhemoglobin curve to the left. Now, as affinity of hemoglobin towards oxygen is high, it does not release oxygen to the tissues readily. This further adds to the hypoxia. To compensate for excess carbon dioxide washout, renal bicarbonate excretion is increased, which maintains PCO2 levels. So this compensation requires about 2 days time. Details explained in my another video on high altitude physiology. You can find the link in the description box below. When even the compensatory mechanisms fail, hypoxia develops and a person will show various clinical signs and symptoms. If there is an acute drop in inspired PO2 to less than 20 millimeters of mercury, it causes loss of consciousness in 10 to 20 seconds and death in 4 to 5 minutes. Such a tremendous and acute drop in PO2 can occur when cabin pressure is suddenly lost in a plane flying above 16,000 meters. Hypertension also occurs in case of severe hypoxia. Moderate hypoxia causes symptoms like impaired judgment, drowsiness, dull pain sensibility, excitement, disorientation, loss of time sense and headache. Other symptoms include anorexia, nausea and vomiting. Long-term effects of hypoxia include production of transcription factors called hypoxia-inducible factors, which have alpha and beta subunits. In hypoxic conditions, These subunits undergo dimerization and activate genes to produce erythropoietin and angiogenic factors. Erythropoietin increases RBC count leading to polycythemia, while angiogenic factors favor formation of new blood vessels, that is angiogenesis, to relieve hypoxia. So let's conclude the topic with this summary slide. In hypoxic hypoxia, arterial PO2, oxygen content as well as hemoglobin saturations are decreased. Arteriovenous oxygen difference may be normal or less depending upon the degree of hypoxia. Cyanosis, that is bluish discoloration of the skin and the mucous membrane, is present and oxygen therapy is 100% useful. In anemic hypoxia, oxygen carrying capacity, arterial oxygen content and hemoglobin saturation are decreased. Rest everything is normal and oxygen therapy is somewhat useful, especially hyperbaric oxygen therapy in carbon monoxide poisoning. In stagnant hypoxia, all oxygen parameters are normal but tissue blood flow is reduced. Hence, arteriovenous oxygen difference is high. Cyanosis is present. Oxygen therapy is not useful. In histotoxic hypoxia, again oxygen content, hemoglobin saturation, blood flow are normal but tissue utilization of oxygen is low or absent. As a result, arteriovenous oxygen difference is low. Oxygen therapy is not useful but hyperbaric oxygen therapy can be useful. So that's all for this topic. Thank you for watching and see you in the next video. If you like my presentations, don't forget to hit like button and share with your friends. Do subscribe to my channel and hit the bell icon to stay updated about new releases on the channel. Thank you for watching and see you in the next video.